Phillips. I am the Chief Nursing Officer at Park Royal Hospital. I am RN with my MSN and in Education and F&P. I am here to discuss healthcare along with this fine panelists.
Hi, I'm Angelina. I'm a PA or a physician assistant at Coastal Med Urgent Care. Thank you guys for having me.
I'm Selynto. I'm the Chief Equity and Inclusion Officer for Lead Health. Super excited to be here today.
I'm Dr. Shadreka, McIntosh, the owner of Sozo Wellness Pharmacy in the Delmar community, and I am excited to be here today.
Awesome. So, what do you think the biggest challenge for healthcare is in the Black community, education or lack of resources? Anyone can answer.
I think that's a great question, and I would say there's a multitude of challenges, not only in the Black community but in all communities. When you're looking specifically at healthcare, I think the way in which healthcare systems in general deliver care is something of a trending topic. Years past, folks would come into hospitals to receive care, and hospitals wanted individuals to come in. Now it's more so, what do you do on the preventative side of things? So there's a lot of education that's taking place. There's a lot of innovative type partnerships as well. Super excited to hear about what you're doing with your pharmacy here in the Dunbar community. But I think one of the biggest challenges is, how do you eliminate the silos of individuals or nonprofits saying, hey, this is only what I do and this is what I do, but how do you connect those individuals and really provide more of the continuum of care? So I think education is important, and in some communities there are a lack of resources. Being new to the area, there's some places that I'll drive and I say to myself, I'm like, wow, this is immaculate, like this is just absolutely gorgeous. There's other places that I drive and it's very evident that this community needs a lot of resources and things of that nature. And I think it's a community type way to bring folks together and really be advocates of all communities as well.
Correct. I definitely agree. What do you think?
Yeah, I think we've come a long way as far as like resources are concerned. Like with the Affordable Care Act, I know that made care more broadly available for a lot of people who didn't have that same access prior. I think what's available to people is one thing that could help make care more readily available. And also just educating people. You're talking about how people were encouraged to go to the hospital, but letting them know that's not your only option depending on the severity. So I'm in urgent care, so we see a lot of things, and letting people know you don't have to go to the hospital for a UTI if you're not with fever, vomiting, like with severe symptoms. So let them know those things. Yeah.
Along that line of what Angelina was saying, I think it really goes hand in hand is what you're kind of saying is education about the resources that are there.
Absolutely.
A lot of times it's just that access to the information and where do we go, how do we deliver that information, because things are not as they used to be. Yes, we have some ways to go and some opportunities, but just I think that's where things are lagging sometimes. People just not knowing. They don't know what they don't know.
Right.
And when you ask this question to a lot of individuals, they'll say, oh, we have the internet now, but what about the individuals that don't have access to the internet? So what way can we get out there in front of that to communicate with these individuals? I know for mental health, it's so large, and there's so many people that don't understand mental health. And I know we're out there on LinkedIn, but we also get out there in the community, hosting events, working with NAMI, and even hosting events with NAMI, the walk and everything for the mental health community to gain the information and the resources that they needed. So what do you feel that people in the Black community have as far as the resources for proper medical attention? Do you believe that they actually have the resources they need? And even if they had the resources, as far as they know where the hospital is located, do they have the resources to get there?
That's a great point, and part of my role as Chief Equity Officer for Lee Health is understanding the whole entirety of health equity, and pretty much how do individuals receive care, regardless of zip code, where they're from, what resources they have, and it's our job as a system to be able to provide that equitable care. I'm a firm believer, again, in community partnerships. So how do we partner with the city, the county, the schools, other nonprofits within the area to really strengthen the whole continuum of care? Because some folks don't necessarily have those resources. You can provide a ton of things, but if they don't have the resources to get there and to get those things, then what good is that actually doing? And if we're being honest, there's a lot of trust issues when it comes to the healthcare systems as well, just given the history of how things have been. And so I like your point of what you mentioned earlier, going out into those communities. And so taking healthcare to those communities to really get individuals and communities to know that not only do we want to take care of you, but we want to also make sure that you have sustainable communities, that you can provide for your families, that you have the education and the resources to do what you need. So I would say definitely those community partnerships are very, very key.
Yeah, if I can, there's a nice plug for what you just said. We all probably know Nurse Practitioner Deanie Singh with Premier Mobile, and she kind of provides that resource. I know she has the brick and mortar location on Colonial and Tree Line, but she also has a bus that actually takes healthcare to people.
I just saw it as we came here.
That's awesome. That's awesome.
But once again, letting people know that that's available, and making sure they know when it's in their area, and then you know, like if you can't afford to pay, or if you're, there are resources like that for you.
Right. You even mentioned telehealth earlier. So you mentioned how do you deal with that in individuals to where they don't have any opportunity to be able to provide different devices and such. I know one of the things I had to post Ian here in the Dunbar, right now we were able to from Hurricane Ian, which is that to strategically put devices in different places where there could be some type of telehealth or something along those lines.
I listen to everybody talking, and I just the importance of addressing. A lot of times people don't connect. You don't have transportation. You have all these great services out here, but I can't get there. I have telehealth, but I don't know how to use it. I don't have the internet. You have these great cooking classes, but I don't have access to food.
That's right. That's right.
So it's all of those things that go together. Financial literacy. I mean, it's just the whole addressing all of those partnerships, and that's why it's so important to figure out what other people are out here in the community trying to serve the needs, and how do we pull together.
And I think one of the unique things in healthcare, especially with community partners, is to really go out and get input from those communities.
Absolutely.
And not necessarily decide on what these community needs, but community, you tell us.
Absolutely, I agree. I love it.
And
I love
for us to very intently listen and then also respond. And if we can't do that, respond back to the community to say, hey, this is why we can't do this right now, but we may be able to do this. But we have to go out and take that proactive approach.
I agree. I agree. So, what do you believe barriers are to education for the African American population specifically?
Barriers to education, you said?
For the African American population.
I think today is a lot different, than it used to be. My son, he's a student at Franklin Park Elementary School, which is here, in this community. And I can speak from that. It's just the facility that they were in. It was just kind of a long time coming for them to get their school upgraded. And that's a historical, it's been in this community since the 1950s before integration. And, it's seen a lot of things, but yet the facility remained the same. And we know as, times change and, the needs change, access, again, that word keeps coming up, making sure that these communities have the same, as everybody else. And it's never going to be equal, but equitable.
Right.
Exactly.
Is the word
Exactly.
that we're
Exactly.
kind of ensuring that equity for sure is something that's needed, in my opinion.
Yeah, and also, like, I don't see my children bringing home anything specifically when they're still young. But I think maybe putting some kind of program in the schools, so to teach the children, this is what you should be doing, because most of my patients don't come to me until they have a problem. Like, if you're young and healthy, it's like, oh, I don't have cholesterol. When's the last time you had your blood check? Oh, it's been 10 years. Or never. Exactly.
Right.
So just educating the youth of what should be done, and hopefully they'll start to make that change, and maybe even educate their family members who may not know to do those. Exactly, absolutely.
Okay, see, oftentimes I find that the barrier is within themselves. Because, and it stems from years ago, and they, some of them or many of them, from my experience, are told that they can't do. I don't use that word can't.
Right.
We don't use that in our house. I wasn't allowed to use it growing up in my parents' house. So, but I find that people really believe that. And I said, no, the sky is the limit. Go for it. Whatever you want to do, go for it. So for me, I think that the barriers, a lot of barriers lie within themselves.
That's a great point. And specifically within healthcare and in any field, I don't necessarily think it's a barrier in education. Sometimes I think it's a barrier in what individuals or the youth actually see. So for example, if they are going to healthcare facilities and they see the physicians who walk through all the time, and the majority of those physicians are white, and I don't mean that in a negative type way, then they associate, oh, I've got to be white to be a physician.
Right.
And so lots of times it's a matter of who they see within certain roles and within certain communities, to where they say, you know what? Hey, that person looks like me, and so I can attain that. I have a pathway to get to there. Or even more so than that, I can sit down and have a conversation as to how do I get to that particular area. So I think also, and I'm sure we do it, but we also have a duty to kind of pour back into the youth as well, to say, hey, you can achieve this. This is something that you can do. We aren't rocket science, and we aren't special in a sense.
Right.
We all
Right.
probably worked hard and really focused in on what we wanted to do, and they can do the same thing. So I think it's also just of what they see and what they're accustomed to, and exposing them to different things also exposes that education and
Absolutely.
keeps their eye on their goals.
100%.
Absolutely.
I think of the saying that exposure leads to expansion.
Right. Right.
So for me, that was one of the important things of coming back to my home community after leaving home for about 10 years for education and career purposes. It was important for me to come back, and so that the next generation can see.
Absolutely.
Because for me, I had to see. I didn't know anything about being a pharmacist. I mean, I knew what a pharmacy was,
Right,
but it
right.
was never, like you
Right.
said, other than the first black pharmacist that I had seen at the time, I didn't really associate it. It was Doc Carter here in this community, worked for Ecker Drugs, and my grandmother used to take me up there all the time with her. But as I was thinking about what to go to school for, it was doctor, it was teacher, it was, those things that,
Nothing pharmacy, huh?
No, not pharmacy at all. But then there was a lady in my church right there that was a pharmacist.
Wow.
Grew up in the church the whole time, not knowing. And then that conversation, like you said, with her happened, and it's, oh, maybe I can do that.
Yeah.
Exactly. So that's just to kind of confirm just
Right.
the importance of us coming back. And you may not even, I came back and coached cheerleading.
Right.
And these little girls, it was just being a positive influence to them. But then they see me later. I didn't know that you did that. So it's like, right. It's making it, I'm a normal person just like you. So it's
That's right.
something that you can do.
Right.
So
Absolutely.
it's important for us to get it in these institutions,
Right.
associations, so
Right.
we see it.
So black representation, in healthcare, you would say is very important.
I think it's important for professionalism as far as going into roles. And then also I think we all know that there's clinical evidence as well as for the importance of that role in kind of relaying that over to health disparities. So if for cardiology, for example, it's been shown that, you know, individuals with cardiology, or if you're looking at OB type things, patients of minority descent have oftentimes great outcomes when their providers are minority person. And so that kind of goes back again to the whole trust factor. And so the biggest piece of that as individuals go through certain things is that stress level. When you come into hospitals and healthcare systems, you're probably not coming for the best of things. And so as you see that provider and you're able to connect with that provider, your outcomes have been shown to be much better as well. So I think the representation is great from a professional aspect. And then when you talk about eliminating health disparities, that's a big piece of it as well.
Absolutely, I agree. I mean, for me, I am the chief nursing officer at Park Royal Hospital, and that's my full-time job. But what I did is to help with the mental health community is I went back, and I teach now at FSW in strictly the mental health program to the nursing students because they need to know.
Right.
I mean, where else can you start from? You know, if you other than in the community, you know, I'm in the classroom setting now, and I can teach them about mental health from firsthand, from being there, working in it. And they so intrigued. Some of them never even thought about going into mental health. I've actually had students come and work at Park Royal Hospital. I'm like, man, this is so different than what I thought. So I truly am a big fan of Black representation, you know, in healthcare across the board. So, do you believe that there's barriers to treatment in general in the community?
The first thing I think of is, I think it came out when we first started asking questions, is financial. And sometimes it's not always a barrier, it's just them not knowing about some of the access that's there.
Okay.
Yeah, and I agree with that. I feel like we mentioned earlier, we have the resources out there, but sometimes the patient may come to me and the initial visit's fine, but then there's something more complex and more extensive that needs to be done, whether it's an MRI or things of that nature, and then sometimes it's like, skirt, like that's that much money, and a lot of times depending on the insurance, sometimes they don't want to cover those extra things. So I think it's not a complete obstacle, but sometimes as you get more complex, I've seen patients fall off that way.
Yes, I know even in mental health, I see them, they'll come in, they get their treatment, then it's time to leave, and you know, some of them might be on a long-acting, you know, medication, but when they go in that community, how much do it really cost? Can they get it when they're in the community? You know, and it's really shameful, so I know we really pay close attention to that and try and make sure that whatever we start them with, they can maintain it in the community.
That's one of the things we do at Lee as well, is kind of work with our community partners. We have community health workers as well to work with segments of the population to work with those patients to, you know, when you go home, you know, call you the next couple days or so just to check and see how's everything doing. Do you understand your medication, prescriptions and such? Do you have a ride to get to your next appointment and things of that nature? So it truly takes a entire community to address those needs.
Okay, so I have a few questions that I'd like to discuss in closing. So what suggestions do you have on how to bring about a positive change in your family, in the community, and your churches?
Wow, that's a great question. I think for me, the biggest thing that I would take away, or biggest suggestion that I would kind of speak to, is that it's going to take everyone in the community. Not just a certain subset of the community, not just a certain demographic of the community. It's going to take everyone in the community to have those positive changes. And believe it or not, everybody will benefit from that. It won't necessarily be one subset of the population or another, but every single person will benefit from that. You'll see economic benefits. You'll see educational benefits. You'll just see great community benefits once those things happen. And it won't be easy, but those are strides that we definitely have to make.
Perfect.
Yeah, and
so,
like for us being here, like we're all busy, we all have a million things to do right now, but we're here giving back to the community and giving a voice to things that need to be heard.
Absolutely.
Absolutely. So what advice would you tell a loved one to overcome challenges in healthcare?
For me, what I usually advise family, close friends is you have to advocate for yourself. And saying that, showing them how to, making sure that you document things when you go into the hospital, know who's caring for you, ask names, what are they going to do before they do it, and just understanding your rights as a patient.
Okay. And what would you tell your patients who feel they don't have resources available to them? I can answer that question myself. I have actually located resources for my patients, went out into the community to ensure those resources were adequate, and took it back to my patients and actually, had them understand that I went there myself. They do have these resources and it is available to you and they are accepting of you. That's what I've done and for my patients. So, if one of you can think of anything that you would.
Well, because we all had to pause for a second, I think is indicative that there's an issue, but there's no centralized place, because some of my elderly patients may have maybe food insecure, or maybe transportation issues, or things of that nature. They just need company. A lot of my elderly are just so there's no centralized place that I know of, and if there is, we don't know about it. It's not. Once again, communicate with them.
Sometimes transportation is available. Some people don't even know that. Some of their insurances will pay for transportation to the the healthcare location they need to go to. So I would definitely also suggest checking with insurance companies.
So funny, to your point, today I was just meeting with the director of our community affairs department, and of course I'm the new guy in 6 months in, and I'm still trying to learn different partners. But I said, we need to develop a community inventory of folks who specialize in food insecurity, folks who specialize in transportation, folks who specialize in education or housing. And that way we relay that information to those patients, whether it be through nurse navigation, community health workers, registration folks at the front desk, because that's where the sustainable care is going to take place.
I love that.
Awesome.
It's more of healthcare. We're almost fixing in a sense, but the community partners and those other folks are going to be the ones who sustain.
That's right. Awesome. Well, thank you all so much. I think that you have really helped the community, and I appreciate everyone's feedback.
Thanks for having us.
Thank you.
Thank you.
You're welcome.